So, good afternoon. I received a message from one of our learners in the Graduate Certificate in Learning Design, the subject designing for learning, bit of a mouthful, um, to clarify some aspects of her approach to the assignment. And I thought, well, I might just record a short little video. I already replied to her with a few points. And then I asked, I'd like to make a little video so I could share it more broadly because it would be, I believe, of value to every learner because it combines a certain complexity and sophistication that is often lost in our pursuit of designing for learning. Now, a couple of things that came to mind as I was preparing for this. One is I remember several years ago having a conversation with we were designing and delivering learning subjects and courses to enrolled learners, and then something came up about onboarding, and then one of the people that I worked with, which I still am perplexed by to this day, but it captures a certain something about the assumptions of what learning design is. She asked me like, "Oh, no, that's onboarding. That's different to what you do." And I said, "What do you mean?" And they the assumption was because it was for other like training staff, and a lot of these existing courses were bought in. There was just this assumption that that was just something you get off the shelf, and I thought, well, no, we can design for anything, really. We just look at the learners. The learners may be 6 years old, 16, 26, 76. They may be in a workplace doing onboarding. They may be a school student. They may be at university. There's every variation. And so it was her assumption that was really quite perplexing that we couldn't that was not something that an instructional designer did because everyone knows you just get that off the shelf, you just buy it and you put it into the learning management system. And then I said, no, well, if necessary, we can actually develop that from scratch. That's what we do. We put together the content and we develop, we start at the learning outcomes or, what are the needs of our learners. Anyway, that's why I really like delivering or facilitating rather this particular subject. Now, it's a little bit long-winded. I apologize. I've got some notes here. I will de-identify the detail, but I need a little bit of that grit to be able to talk to it. This learner that sent in the request, she's had a little bit of time looking at project-based learning as well as a couple of others. I've got these in another tab. Self-structured group learning and also team-based learning. Now, I won't go into the detail, but just the fact that she's brought those up as something that her learners are already doing, or, it kind of is something in her real world, that tells me already a lot about the learners. They've got a certain autonomy. They're probably postgraduates. They're not first years. It's not an onboarding resource. It's a resource or a situation rather, context where these learners, they already know stuff, just to put it in everyday language. So that can help us with our approach. So she's in healthcare, or she wants to design for healthcare, and she wants to base her assignment on what she's already doing, at least a little bit of an overlap. I think that's a really good idea because we want to always design things for the real world. And the real world, we're solving a problem basically. And so because she spent a little bit of time, and I like the idea of that and the practicality of looking at the different approaches. Now, she says some of the content is already pre-recorded presentations, subject matter experts, etc. She mentions this is a more cost-effective, and there's other, options. And it goes into a little bit more detail about it's like a extension of it's not like a foundation knowledge, it's like an elective type thing for these learners. Now I've just kind of instead of letting you know who they are, it could be dentists, nurses, physiotherapists, radiologists, anyone in healthcare, I think. But I encouraged her. She told me what the content was going to be, but instead of just supplying that content, there is opportunity to tease that out and expand it a little bit in the spirit of learning design. Because there's why would you choose a video over, say, a research article? Or would you combine the two? Or she mentions a textbook. So there is a lot packed in, but as I tell our learners, there's only 6 weeks. We can only achieve so much. So we try and have a little sample, a snapshot of just some of the content or some of the aims, the learning outcomes. Now, she mentions social interaction and its relationship in improving learning outcomes, also problem based educational strategies. And in something like health sciences as well as education, certain very human based practical subjects are really good for problem based learning. But we can't just we need to kind of design for it. Um, and so the fact that she's going to use not only problem based learning, but various approaches related to team based or working together, that's a good thing because but we want to try and link it to why are we choosing that. Um, and I mean, you may have heard of flipped classroom. I'm just reading from my notes. And she wants it to be fully online. So there's synchronous sessions with an expert facilitator, a little bit like our course in a way. Um, so they can concentrate on clarifying and extending. So already we've got an approach. And so because we're designing it, we need to be able to justify our decisions, not just come up with things. I should have said also very early on when we're designing for learning, we're not just gathering content and dumping it into a learning management system. And sometimes that's the default, even with seasoned practitioners that they're on the clock. They don't have a lot of time and they have maybe 4 hours allocated to a module and then they gather all the content and then they put it into sentences and then they just hand it over. Work is done. Sometimes in the past, I've asked, well, that's our starting point. Can we have a meeting? And I've been told very professionally and clearly, well, no, I've used up all my time for this module. So unfortunately, the content dump is only that's the all that the students are going to experience. And so um, I'll get back on track. Um, these learners have graduated more than 15 years ago. So that's significant. They're going to be bored if we just dump content and supply it to them. Like you see that sometimes in a onboarding, like WHS type of things, which is unfortunate, but the reality. So these are more sophisticated learners. They're definitely adults. They're definitely at a postgraduate level. So we need to, I'm just reading, they need to demonstrate competence in the various tasks. So if that's the end point, we need to set them up for success and then it's a really good idea. She's proposing social connections and then the trust that's associated with that. There needs to be a degree of time allocated. All this is happening online as well. So we have to kind of put our thinking caps on and figure out, well, what's an appropriate mechanism? And this is where something like the fact that they're postgraduate learners, that works in our favor because they're more going to be more pragmatic and practical. They're probably very aware of their work study life balance. So we can kind of have very short, sharp, very directed, um, kind of more like summative summative assessment tasks maybe would be a really good thing in this territory, um, so that they're not just waffling on a little bit like me. Maybe I'm just waffling on. Um, just bear with me. And then she's proposing that a moderator would explore complex clinical scenarios. So I really like the sound of that, because these postgraduate adult learners who are probably doing this as an elective of some sort, we need to challenge them. And if we can put them into a social situation where they're comparing maybe clinical notes or their own professional experience, that is a really good thing, because then we can start to get quite a bit of momentum. They're not going to be passive learners. Um, Now, she does say requiring something, blah, blah, blah. I don't even know what that is. It's a medical term, it's some sort of analysis. Sounds sophisticated though. But if we can come up with a project-based approach that is also flexible. It's flexible by the fact that it's online. And so it's like this combination of the kind of pedagogy and the concept with the practicalities of, say, online delivery. And we're very lucky because we can have video and that kind of thing. Um, if they're going to be synchronous sessions, the session itself would have to be designed in relation to possibly the setup. We're almost like setting them up for these sessions. So they're not going to do the whole thing. They're not going to do an 8 hour day online synchronously. So maybe we kind of arrange some previous learning, or they watch a video, they make some notes, so that the whole thing is setting them up as preliminary, like in a flipped model. So all of these decisions are really good decisions, but they generally would have to be justified with the academic literature. So there's an abundance of different approaches, theories, models that would tap into this. Not There's no one model that you'd be able to tick the box and it's all solved. It'll take a bit of sorting and identifying. But something like, say, Merrill's principles, I know I'm a big fan of Merrill's principles, but if we look at, say, what are the real life examples? So we know that they're dentists, and it's some sort of analysis of something or other. Maybe it's like an x-ray or a chart or some sort of diagnostic something. We could provide that for them in week one, and they've got time to work on it. And we could direct that, and they could bring their own examples. And then we could develop some sort of skill in identifying something or other. So it could be paced out over time. It doesn't all have to happen in the one session. There's lots of different variations, but I guess it's revolving around a knowledge of our learners and what they prefer, what they will tolerate, what they would really enjoy, what they're bringing to the situation. All of these things that sometimes just get lost. People are so focused on knowledge or content, and then they forget about the human beings that we're designing for them in a way. And a good learning designer doesn't have to be there to deliver the course. This is the whole point of the design process. You're handing it over to somebody else that might deliver it. Um, and so finally, she's asking about a synchronous session to allow for flexible and asynchronous independent learning. See, independent learning is, I guess they may be doing some independent learning and then coming back in to exchange ideas or share their insights or something like that, but not in a random way, in a kind of measured way. Now, in the assignment, you won't need to outline every little detail. We're not developing a lesson plan, for example. It's just at that top level so that you're back to basics. We've got learners and a context and their needs. We've also got a few learning outcomes that are reasonably succinct and specific, but then we're linking that to our decisions about what sort of model or framework or approach we would think might work. So once you get started on this, it actually starts to explode in a really positive, productive way. But we only have 1,000 words. So also one of the questions that she's asking is, can we use references from within the course as well as other ones? She has specialist healthcare education references. Of course, you can bring those in because they, in a real work situation, you would rely on those. You'd bring those in. So it's not to say you should go racing for looking for random references, just as they're relevant. And so something like healthcare education references, especially if you work in a sector where these are a recommended approach or something like that. So they can sit really comfortably side by side with our other academic literature that as and it comes alive when you start to put in this specific content. Um, Now she's also got more random thoughts that she sent me about defining the characteristics and motivation of the learners, which I really like. We touched upon that a little bit, but that's at the heart of our design in a lot of ways. Not to say that we run around and we're designing it one course for one individual. We're looking at broad characteristics. And so if she could look further at these healthcare professionals and their sector and what they've done prior, what they're doing after in terms of study and their professional context, all those can inform when or the approach of what's going to be online, how long will it be, what activities are done in say a breakout room versus those activities that are done Tuesday last week type thing, and then you make your notes and you bring them to the session. um, I'll just finish off. um, yeah, she mentions about cause and effect. I think yeah, it's getting to the heart of the needs and the motivation of the learners and linking it to our design process so that we kind of have little clusters of, I guess law students is another good talking point. Law students that are first year, they're going to respond to different approaches to law students that are just about to graduate or that are used to doing sort of mock trials, things like that. So if you have it, the inside scoop, which it sounds like she does, then that can go a long way in essentially making decisions to develop not the content, but the activities and the general structure and approach to a subject or a course. So, what would this look like in a real situation? Well, in our report, which is 1,000 words, it would just be a top level outline of what they're doing. Probably a little bit about there'll be an online course. They'll, they'll tap in regularly. They'll have this other stuff they do in their own time. I guess I'd like to know a little bit more information about the how they're going to interact with each other, and if they've got that autonomy, maybe like with a community of practice, that sort of thing comes to mind. Um, and then they're not just meeting up to talk generally; they're kind of working on their assignment, and so that would have to be built into um, the detail when the course is developed. But you could just tell us at a higher top level um, what your plans are and why that's in place in that particular um, regard. I think I might leave it there. So hopefully this has been of help. This is a kind of probably one of the more sophisticated, which is why I liked it, sophisticated situations because it's acknowledging the learners and where they're at and what the complexity of the content, how they're going to engage with the content, how they're going to work with each other. I like the social aspect because it reflects a healthcare workplace. They would have to, all these elements that are often hidden, they're invisible unless we look for them and capture them and use them in our design. So hopefully that has been helpful. So thanks.